So today's topic of discussion is time periods in communicable diseases. The incubation period, communicable period, generation time, serial interval and window period will be discussed here. So stay tuned. So first of all, we will discuss the definition of incubation period of a communicable disease. Now what is communicable disease? A communicable disease is one that is transmitted between person to person or from an animal to a person. It is sometimes referred to as infectious disease or communicable disease, and it is caused by pathogens such as bacteria, virus, fungi, protozoa, etc. Now coming to the definition of the incubation period of communicable disease. The incubation period of a communicable disease, it is the time interval between the entry of organisms into the host and the first clinical manifestation of the disease. So, it is basically a time interval between the entry of the organism into the host and the first clinical manifestation of the disease. Okay. Now, this incubation period is varied for different diseases. It is different for cholera, influenza, dengue, strep typhus, leptospirosis, and so many other diseases. So, the incubation period of cholera is between 2 hours to 5 days, whereas the incubation period of influenza is about 2 days, but it ranges from 1 to 4 days. Whereas the incubation period of dengue is about 5 to 7 days, but it ranges from 3 to 10 days. And the incubation period of strep typhus is between 10 to 12 days, although it can vary between 6 and 20 days. So here it is seen that the incubation period for different disease is different. Okay. By knowing the incubation period of infectious disease, one can provide the important information during an outbreak, when infected individuals will be symptomatic and most likely to spread the disease. It also provides clues about the cause and source of disease when the factors are unknown. The incubation period for a given disease also offers insight to prognosis, including severity of the disease and how long an individual illness might be expected to last. The potential treatment strategies may also be inferred from these incubation periods, because these incubation periods varied for different diseases. Okay. Now, there are some factors that influence the incubation period of the communicable diseases. And these factors are, so the incubation periods is influenced by, number 1 is virulence of pathogens. The virulence of a pathogen influences the incubation period of the communicable disease. Next one is the inoculum or the infective dose of the pathogen. The inoculum or the infective dose of pathogen also influence the incubation period. If the infectious agent, that is the micropositive pathogen or the microorganism, that is it may be either virus or bacteria, enter into the host is more, then generally the incubation period is so short. So more the causative pathogen is entered into the host, and short will be the incubation period. Next is the route of inoculation. The route of inoculation also influencing factor for the incubation period of a disease. For example, in case of rabies, the incubation period ranges between 6 days to 6 hours, and it depends if the bites on the head or face or on the extremities. Because the virus is neurotropic, it affects the central nervous system. So, if the bite is on the head or face, it will be up to 1 month. Whereas, if the bites on the extremities, that is in the feet or thigh or leg, then it may be up to 3 months. So, the disease for rabies, the incubation periods will be varied, and it will be depends on the route of inoculation. Number 4 is the rate of replication of infectious agent. The rate of replication of the infectious agent is also an influencing factor for the incubation period. Number 5 is susceptibility of the host. The host susceptibility is the influencing factor for the incubation period. If the host is more susceptible, then the incubation period will be short, and if it is less susceptible, then the incubation period will be long. Okay. And number 6 is immunoresponse. Immunoresponse is a very important factor in case of disease progression, in case of the incubation period of the disease. Okay. Now, consider this extrinsic incubation period and intrinsic incubation period. In case of vector-borne diseases, the terms intrinsic incubation period and extrinsic incubation period is used. So these two terms are used in case of vector-borne diseases. Okay, in case of vector-borne diseases, the terms intrinsic incubation period and extrinsic incubation period is used. Now, what is intrinsic incubation period? Intrinsic incubation period is the time taken by an organism to complete its development in the definitive host. So, intrinsic incubation periods is the time taken by an organism, that is the pathogens, to complete its development in the definitive host. Now, what is definitive host? Definitive host is one in which the pathogen's sexual reproductive stages are completed. Okay. Next one is the extrinsic incubation period. It is the time taken by an organism, that is a pathogen, to develop in the intermediate host. Now, what is intermediate host? Intermediate host is one in which the pathogen's asexual cycle is completed. Okay. Now, let's discuss some other time periods in communicable diseases. These are communicable periods. The period during which the reservoir is infectious to others. The period during which reservoir is infectious to others. So, during these communicable periods, it is transmit the disease to other person. Next one is the generation time. Generation time is the period of onset of infection and the maximum infectivity of the host. So, it is the period of onset of infection and the maximum infectivity of the host is known as the generation time. Next is the serial interval. The serial interval is the period between the onset of first or index case and the secondary case. So, it is the period between the onset of first or index case and the secondary case. The first case is the first case in which the diseases occur is known as the first case, but index case is other. Index case one which is come into the notice of a health personnel. This index case may be either the first case or it may not be the first case. Okay. And number 4 is the window period. It is the period between the entry of the pathogen. Period between the entry of the pathogen and the production of antibodies is known as the window period. When the pathogen enters your body, our immune system recognizes it, and in response to this pathogen, there is a production of antibody. So it takes some time. So the period between the entry of the pathogen and the production of the antibodies is known as the window period. Okay. These are all about the time periods in communicable diseases. If you like this video, please like, share and subscribe to this channel. Thank you.